Good morning. Welcome to this very important forum. The discussions that we will be having today. Dick Salvaterra, I'm chair of the America's Health Foundation, non-profit based in Washington, but our HQ is here in Bogota. We've worked throughout the region for 15 years. We've worked around rare and orphan diseases. That's been one of our priorities. And it's a pleasure to have the opportunity to work with our colleagues and sponsors, especially with Urkel, with Diego. We've been working together for 3 or 4 years, sharing the message and creating this organization. I'm a member of the board of directors, as Diego as well. He's the chair of Urkel, and he's also a member of the board. Would also like to thank the support that AstraZeneca has provided, all of your support, and they are sponsors of this event. We've also been working with Urco. We've created the first international congress of rare and orphan diseases for Latin America and the Caribbean. And the third version of this event will be carried out in August next year in Santiago de Chile. So it's a pleasure to be here and to start with our forum. I would like to introduce Felicita Colombo, our Public Affairs Director. Felicita?
Gracias a todos por.
Thank you everyone for being here, for joining us. And with this, we will start today's session. And we will have a discussion on the resolution that was approved regarding rare disease from the WHO, from the World Assembly. This is the matter that brings us today. Thanks, Dix, for your opening remarks. And also we would like to thank Urkel and AstraZeneca for their sponsorship. Now I would like to introduce Diego Gil. He is the chair of ERCO, which is Rare Diseases of Latin America and the Caribbean. He is also chair of FECOER, the Colombian Association for Rare Diseases. He will be giving an introduction and a review of the situation and the roadmap in Latin America in order to start discussing the matter at a regional level. Diego? Thank you. Good morning. So today, before anything, I would like to thank everyone joining us, not just here in Bogota, but everyone who's joining us via streaming. So we have patients, caregivers, families who have been facing enormous challenges in terms of access and comprehensive health services, and also facing social challenges, trying to be included. We're thrilled of this cooperation, working with Urkel, AHF. Also, we would like to thank AstraZeneca for supporting this initiative, which is something very important for us. So please, if we can put the PowerPoint on screen. I would like to start with a review of the moment and a summary of the things that the region is experiencing right now, because we're on a roadmap that is very important. Please, can you set the timer so that I don't go over time? In Latin America, so that it's clear, we've said it in different spaces, in Latin America, we can have more than 40 million people that have a rare disease. So sometimes we say that these diseases only impact few people. When you look the overall group of diseases, it has its
Ok. Siguiente, por favor. Siguiente, por favor. Adopción en Ginebra, estuvimos respaldando desde ERCAL, desde Latinoamérica, y estuvimos haciendo todo este proceso de abogacía. Como ven acá, tuvimos una coalición, ahí ven los logos de alrededor de 270 organizaciones de la sociedad civil que respaldamos esta iniciativa. 41 países copatrocinaron esta resolución, entre ellos muchos de Latinoamérica, que los gobiernos que son parte de los Estados miembros de esta iniciativa estuvieron respaldando. Aquí vemos una foto de ese documento de resolución, son 8 páginas. En las primeras 4 van a encontrar que está como el contexto, en las otras 4 son como los llamados que se están haciendo a los diferentes Estados miembros para la implementación. Y bueno, aquí vemos uno de los posts que se hicieron por parte de Rare Diseases International de este momento. Siguiente, por favor. Esta resolución obviamente implica unos elementos fundamentales. Y aquí los denotamos como en 6 bloques, ¿sí? Lo primero que busca es integrar a las enfermedades raras en todo lo que tiene que ver con las políticas y la planificación de la gestión en cada uno de los países, porque algunos países que no tienen, digamos, este tipo de enfoque priorizado en los sistemas de salud, también fortalecer el sistema de salud, los diferentes sistemas de salud para poder cumplir con estas necesidades, dar respuesta a las necesidades de la población en específico, mejorar la calidad de vida de las personas que viven con este
melhorar a qualidade de vida das pessoas que vivem com esse tipo de condições, mais além dos assuntos de saúde, gerar consciência cidadã, que é muito importante para que todo cidadão conheça sobre a importância de
impulsar la investigación. Recordemos que en enfermedades raras menos del 10% de estas condiciones tienen oferta terapéutica. Entonces, todos los esfuerzos que se hagan en términos de investigación y desarrollo son fundamentales. Y por supuesto, promover la equidad. ¿Sí? Vemos también esas dificultades de acceso que hay, por ejemplo, en países que no tienen, digamos, posibilidad de brindar atención a muchos de sus habitantes. Incluso al interior de los países hay muchas dificultades.
Tem grandes dificuldades.
Also, even within big cities, sometimes people believe that in a city, in a big city, healthcare services can be found, but that is not always the case.
Y eso es importante que
And now the resolution, and this is key to have it clear, because here is where we can play a fundamental role. We want to promote
global,
a global plan regarding rare diseases, so a 10-year roadmap.
Esse trabalho vai começar a ser feito.
I will be summarizing a little bit about that roadmap that has been
realizado, mas vamos
that we've been working
trabalhar
on, but we will be working on the execution of different strategies throughout the next 10 years.
Aquí vemos como básicamente los pasos. Entonces, en primer lugar, en lo que tiene que ver con el periodo 2026 a 2028, la OMS tiene el compromiso de redactar este plan de acción global, ¿sí? Es un periodo de 2 años en donde se requiere una fuerte articulación con las organizaciones de la sociedad civil y va a haber unos procesos de consulta bastante importantes con los diferentes grupos de pacientes. Posteriormente, se espera que la Asamblea Mundial de la Salud en el año 2028 apruebe ese plan que se formule, y para que, digamos, se pueda implementar de una forma adecuada, tiene que haber un proceso, por supuesto, de difusión, y luego, cada 2 años, tiene que haber un ejercicio de monitoreo, de verificación, de retroalimentación acerca del cumplimiento de cada una de estas metas. Siguiente, por favor. En el contexto de Latinoamérica, importante tener claro, ¿sí? Esto sucede, por supuesto, en muchas otras regiones, pero para tener claro, el impacto de la resolución no va a ser el mismo, por supuesto, en cada uno de los países, ¿sí?
Every single country. There are countries in Latin America, for instance, that we have income levels that are very different. There are countries with high incomes, the other ones with medium or other lows. And this will also have an impact on the implementation of the plan. But there are also countries who have breakthroughs from the normative perspective, from the regulation perspective. So the impact of the plant is not going to be standard. It's not going to be the same for each and every single country, because while there are some cross-sectional challenges, it's important to consider each of the breakthroughs and advances of each of the of each and every single country. The work that we've been doing with RDI might have and experience three types of impact. For instance, we have an A-level country that have high income and that have type or a certain roadmap for rare diseases. Then we have B countries, which are medium income countries, where you might find a roadmap for rare diseases. And in C countries, which are low income countries that have no roadmap, no plan, no implementation prepared. And so the impact can be differential with each of these. Maybe in a type A country, we can have Uruguay or Chile, which are high income countries compared to other countries in the region. So Chile already has a bill that was recently approved. In a country type B might be Brazil or Colombia that has a very robust regulation, even Argentina, and C country might be Honduras or other countries like Ecuador, so that we understand a little bit that it's important to align expectations and manage expectations, because the impact might be differential or is going to be differential. What's clear is that the WHO will provide guidance and support throughout the different regional offices, in this case for the Americas, through the Pan American Health Organization, which also poses a challenge for multilateral organizations. I had told you in the beginning that one of the key elements in all of this work that we will be conducting throughout this 10, 12 years with the execution of that global plan is going to be cooperation. We cannot materialize this resolution if we don't work together jointly, especially in Latin America and the Caribbean. We need to promote synergies, and also from RDI, an organization that hosts all the patient organizations from different parts of the world. We've been cooperating, and we released a little over a month ago a bid to create a group in Latin America to start preparing all of those resources, to collect all the needs, all these key elements, in order to have, after this information, and have it as a resource in the consultation that we will have with the WHO. Let's remember that WHO is the one in charge of writing down that plan, but it's the civil society, the one responsible for collecting all of these resources. So we have this cooperation in which RDI, jointly with these working groups at a regional level, not just in Latin America, but in every single region of the 6 regions of WHO, we must have special communications. We will also have conversations with members of RDI, which is a little over 120 organizations. There will be a lot of communication between different member states, organizations, and so activating those discussions in every single country is going to be crucial. Here's where we have an important role to play, the patient organizations, in order to communicate, manage, not just with the governments of the countries, but with each of the stakeholders, of those strategic partners that are key in implementing them. And also the exercise in cooperation. As I've mentioned, there's a coalition that supported the resolution, a little over 270 organizations from civil society. And in order to wrap things up, it's important to have clear that everyone here, we can be part of that task force. We can all contribute. We can all participate. We have a bid, and there's going to be a role of leadership from that group, because the challenge is we need to guarantee that the global plan, this 10-year plan, will reflect our needs, our expectations, that it's going to address the fundamental, the patients, the families, the caregivers, so that we can generate a regional synergy in order to see those advances and reduce inequality in the countries. As I mentioned, there's a lot of stakeholders that can be part of that task force. We had a period of opening of an open bid where we had specific criteria. And here we have basically the real justification of why it's important to be part of this cooperation exercise. Here in Latin America, we need to do advocacy in order to have a larger global impact. How is it that from the region we can have an impact on that plan? We can also make sure that all the voices are heard, voices from our countries, and in order to promote and support leadership in advocacy, building those networks that a lot of us have been working on for a long time. There's going to be a lot of opportunities of capacity living for development, just for the patients, but for all the different stakeholders. RDI will also be promoting, and we also hope that from URCL and AHS we can do whatever it's possible in order to support, because there's going to be we're going to be facing huge challenges, but we need to develop those skills and those tools, and finally we need to share those experiences into the local, regional, and global practices. And so in order to conclude, the key steps that we will be having, we launch that task force that is going to be promoting that regional work. So it's very important that everyone who's hearing us, who's listening, becomes a part, an active part of this task force. We have the open bid right now, but everyone can contribute on the way. And November 2025, meaning next month, we hope that these groups are consolidated so that we can start doing the work, and then we will start defining the specific actions of that Latin American and Caribbean regional task force. And starting next year, we'll start to materialize all that regional joint work. So this is the summer. So now we will open the different discussions in the different panels. Thank you very much.
Muchas gracias, Diego. Bueno, ya vimos el panel.
Thank you, Diego. So we have the general landscape of Latin America, and what are the projections for this task force that I would say is regional, but it's also important to start working at a national level in each of the federations in order to have a plan set up for the local stakeholders. And in ERCA, we're working at a regional level, but the idea is also to promote that each of the members of ERCL can reproduce this at a local level. So we've called you in order to continue this conversation, which Diego already mentioned did not start today, is not starting today. This is part of a larger work. And so the resolution was a landmark because it acknowledges rare disease as a public health matter. So it was a call of attention to the countries to integrate them in their health policies in order to promote, diagnose, treatment, research, to work on access in order to improve financing mechanisms that are innovative, and so on and so forth. There are a lot of fields in which the resolution will have an impact on. This forum wants to consolidate a space at a regional level that continues growing, promoting dialogue, and incorporating new voices, as Diego mentioned, new stakeholders, new partners in Latin America, in order to continue the dialogue. because this is the starting point of a joint regional work. And this has already started with HSS, ERCL at a regional level, but we hope to have new regional actors throughout the way. Throughout this month, we've had different dialogues with RDI, with ERCL, we've had webinars, closed meetings, informal meetings, and we've started to discuss how is the regional plan of action is going to be traced. And so now I would like to invite you to hear a summary of these conversations and meetings that have happened in the last few months with a video. So please pay attention to the screen.
¿Un sonido? ¿Sonido?
de Relaciones Exteriores y presentar oficialmente la resolución de la ONU como una prioridad.
Hasta 300 millones de personas en el mundo viven con alguna de las más de 7.000 enfermedades raras conocidas. Puede tomar más de 5 años identificar correctamente una enfermedad rara.
Una de las estrategias más eficaces en Brasil ha sido la construcción de puentes entre las asociaciones de los pacientes e instituciones públicas y también de empresas farmacéuticas.
Seguramente esta resolución va a ayudar a seguir impulsando todas estas iniciativas de colaboración entre diferentes
corporations between different stakeholders, which is the most valuable asset. One option is that all participants can tomorrow just meet their MPs, health ministries, or international relationship ministries and present this resolution as a national priority. This generates this awareness that each of the members will be carrying this voice. That way we will be benefiting not only ourselves, but also millions of people.
Está la comisión preparada para pasar a
So
aprobar
the Commission is ready to approve the resolution project entitled Rare Diseases, a Priority.
No veo objeciones, queda la
There are no
resolución
objections,
aprobada.
the resolution passes. So with that, we will be starting our opening panel. What we wanted to do with this regional discussion is bringing it from a global scale all the way to the national scale, to a local scale. So you will experience each of the panels will bring things closer to each of the countries, also highlighting at the beginning of the Congress of FICOR, which will be starting today as well. The panelists for the first panel, I'll be introducing them, and I will ask the panelists that are here to please come up to the stage once I call them. Dr. James Fitzgerald, Health Systems of the Director of the Pan American Health Organization. We have Durhan Warren-Rieger, Chair of the Canadian Organization for Rare Diseases and member of the board of Asia Pacific Rare Diseases International. It's a pleasure to have you, Durhan, here. It's always an honor and a pleasure to have you. Alejandra Humbert-Perry, CEO of Rare Diseases International. She will be joining us remotely from Europe. We also have Diego Gil, chair of ERCL as well as FICOE. And so with this, we will start our opening conversation. So, to cut the... All right. So first of all, I would like to welcome Dr. Fitzgerald. I would like to start with you, since as we were discussing, we were having a global discussion. So my first question is, which are the main barriers and opportunities that have been identified from the Pan American Health Organization in implementing this resolution, and what's the strategy that the region can play in the design of the roadmap? Good morning, Felicita. Can you hear me? So it's an honor to be here with you this morning. Yeah, I would like to, well, I'm sorry, I'm having an echo in my audio, so if anyone can help me with that, that would be wonderful. So thank you for the question, first of all. And so in the context that we have in the region of the Americas right now, we have countries, as we know, a diversity of countries in terms of political structure, public management, organizational systems, socioeconomic development, as well as this is something that has an impact in terms of health systems in our region. This also means that we have a diversity also in the context of operational resolutions in terms of addressing rare disease and approaching rare diseases, and making a joint effort and joint initiatives in terms of the challenges that we need to face so that the people that experience these diseases can have something. Now, regarding equality, that's key. That's at the core of the matter. And we acknowledge the importance of the resolution of the WHO to include this matter of equality and equity in this resolution, noting that it's people and that there are conditions of high vulnerability, people living under conditions of poverty, remote areas, rural areas that have no capacity to have a communication or direct interaction with the system. So different populations like indigenous or Afro-descendant populations and communities that are also significantly impacted by the lack of access to services. Now, if you ask me what are the main barriers, I would say first, surveillance capacity, so vigilance, sanitary, and the low capacity of the health system.
To find out where are the people from and what are the conditions of those people and what are the diseases that we need to register. I will register them. And this is the first step that I think the regions and countries should have to strengthen regarding eliminating these barriers to provide universal access to health. And according to this, the capacity of diagnosing and mostly with children and mostly in all of the population that have life resource and the capacity to afford treatment. We are aware of this, and we know that many of these rare diseases imply treatment that are considered with high cost and high complexity. That includes important expenses for the health systems as well as the people. And in many countries, there is no financial protection needed to provide access to this treatment of people. So it implies that the person should pay from their pocket, from out of pocket. So this is, to treat these cases, turns out to be catastrophic cases, and apart from the continuity of a process during the course of life, there is a matter related to care system in the same country. Apart from the mechanisms that from providing services according to the national services, women are the ones that take care of children that have particular needs at home or members of a family. That implies that capacity to generate income in homes and to keep the conditions of life in this house is difficult. So financial protection, not only for a person, for the families, it's a key element in which we have to build care systems in the same countries about this. So that is why the care at a long term, it is important to be considered. And many of the countries do not have the capacity developed in many countries, as it was stated by or discussed by Diego, that from the phases and capacities, installed capacities available in the health systems, including not only the perspective of the services, but also other qualities that are needed regarding rehabilitation, functional capacity, and disability. So this is a complex topic, of course, and regarding policies and governance mechanisms to monitor the processes at a national level that go beyond the health systems that imply participation of other services or sectors, the work, social protection, and mainly for the countries, and including this topic. And about that, negotiating with the ministries of finance to allocate the resources that are necessary for this. And I think these are the main challenges and Felicita and in the region of the Americas in this moment. Thank you very much, Doctor. We went through, we discussed many of the aspects that related to the resolution. I think about your vision about Latin America. And I would like to move forward to Alexandra. Alexandra, welcome. Thank you very much for being here with us. What is the view or the vision from IEI from the situation at the global level regarding what is happening from the federations and the groups of patients in the world, and how do we consolidate a network of regarding this new mandate from the WHO? How is RDI working in this regard?
Hello, everyone. Very nice to be with you. Please apologize for my voice. I'm down with a flu, so maybe it's better. I was not with all of you. I would contaminate, but I'm looking forward to meet all of you in the ERCAL conference then in next August, as you mentioned. Thank you, Diego, ERCAL, for bringing all the leaders of the community of persons living with rare diseases and also policymakers and health practitioners. I think you summarized very well the situation. You explained very well what represents the resolution, the first resolution at the World Health Assembly on rare diseases. And for RDI, this is a work that we have done for many years. It's not just had happened. This is the continuity of the work that we have done with having a first UN resolution in 2021. And now it was important that we were be able to have a resolution at the World Health Assembly to tackle the challenges of health related to health diagnoses, etc., for people living with rare diseases. But most importantly, I think that this resolution asked the WHO to develop a global action plan. And initially, when we started to discuss with some member states about what should be in the resolution, it came very clearly that we needed a framework for actions, not only a set of recommendations for the states to do, but a framework that will provide some targets, clear targets, indicators, a monitoring process. Because we've seen so many resolutions or so many roadmap and strategy that was extremely with all the principle in there, but we're lacking implementation. So we hope with this resolution that asks the WHO to develop a global action plan, we will really have an impact on the ground, because at the end, this is what we want. We want that those commitment, political commitment, create an impact for our community. LDI has, again, the past 2 years, while we were advocating for that resolution, we also work with our members for them to see the benefit of a such process, to understand what it could be to have that resolution and what it could be for them, because we know that often this is at the community level that the change happens. So we had to prepare the community, and we continue. So Diego presented to you the regional task force that we are putting together. And those task force have really two main objectives. The first, or two phases. The first one is to ensure that the members in the region. I have an echo. Okay. The members in the region have a voice in the building of the Global Action Plan. So this is the phase of the development of the plan. And the WHO regional offices will have, I believe, a key role. So I'm very pleased to see a representative of WHA here. And then the second phase will be about the implementation, because we will have a Global Action Plan, but then we will have to implement it. And this will have to be implemented with all the stakeholders, not only the member states. So the member state will have to work very closely with the community, with the private sector, and the health practitioner, hospital, etc. So this is what we are trying to do in RDI. It's to bring all the different stakeholders together already now, to be ready when we will have the Global Action Plan to be implemented. So on one hand, making sure that the Global Action Plan is embedded into the realities of the different regions. And then secondly, making sure that we will be ready to implement that Global Action Plan. But I just want to finish on that question to say that at the moment, we have discussion with high-level people in the WHO headquarters, notably the Assistant Directeur Général Jérémy Farrar, that will actually lead this work. So, but we still do not have a clear work plan, and we do not know yet how the consultations are going to take place. But we've been informed that the WHO headquarters is working on it, so we are very confident. And RDI and its member and the coalition that we have set up that represent more than 300 organizations are ready to contribute to that work. So we are waiting with impatience the information from the WHO headquarters.
Thank you, Alexandra. Muchas gracias por tus comentarios.
Thank you for your comments, Arjen. Now, voy a...
Okay, with Spanish. Okay.
Well, from Asia Pacific, the region best practices. What has been done in Asia Pacific region that can be replicated in the ERCOS region? What are the barriers that you have in there, and there are similarities how to determine it in the pool of stakeholders? There are other regions that should be supporting us and could start the path about what they are doing. No tengo audio.
First of all, I wanted to thank Diego for inviting me to this, and also to HF for continuing to push the efforts on ERCO. So unlike what you're saying, I do not think that you're going to learn best practices from Asia Pacific. What we want to do is, in the Asia Pacific area, also learn from Latin America and Caribbean. And one of the things we want to do is make sure there is shared learning. But also beyond that, there's the ability to work synergistically, and that we can identify specific things that, yes, we can do within the different countries in Asia Pacific. And especially, I think, as I was mentioning to some, we've got in Asia Pacific, we have the advantage. We've got high income countries. We've got Australia. We've got Japan. We've got Korea that are really able to lead the way in terms of development, investment in highly innovative treatments and plans. But we also have a huge level of low middle income countries, the ASEAN countries, that have really risen. Certainly were huge parts of the WHO resolutions. So Malaysia, Thailand, Indonesia, the Philippines, Singapore. Well, Singapore is a high income country, but they work with us in the ASEAN, and we have the opportunity to take advantage of that. So one of the things we are talking about is what are the things that we can cooperate and collaborate on? And, probably the most important that has been done, and this has been done globally, the beauty for rare diseases is, as we all say, that there are thousands. I don't know if it's 10,000, but it doesn't matter, 7,000, 8,000, 9,000. There are thousands of rare diseases, but there are strategies that work across these diseases. There are ways in which these diseases, because they're in high-income countries and low-income countries, have actually strategies that work across the diseases themselves, which I think is very important. So within diseases, hemophilia is a good example. Cystic fibrosis is a good example. When we look at some of these diseases, pulmonary hypertension, yes, what they're doing is they're saying, we can do this here. We can support our family who is in some of the, what you call the B countries. I don't know if they call themselves B countries, but we can, the middle income countries, and we can do this also for those that need that help to get started. Newborn screening is one of those brilliant things that have come out of rare diseases, quite frankly. Where else can you get a strategy that would say we can test for 20, 30, 40, 50 diseases with one mechanism, and that we can do this across the globe, and we can share that information across the globe? So one of the things we're doing in Asia Pacific is really trying to promote newborn screening and trying to promote the sharing of that information, but also promote the expertise. And I'll give you another concrete example, because it's great to talk about policies and it's great to talk about, how we're going to kind of look at countries to do these things. We know in the rare disease community, whatever happens, it comes from us. But it also comes in partnership. And I'm actually delighted to see AstraZeneca. I'm delighted to see HF here. Because we know that in the rare disease community, it's these kinds of partnerships that allow us to advance. In no other disease can you think about, maybe cancer a little bit, you have the very highest level of technology. Gene therapies have come out of rare diseases. mRNA therapies come out of rare diseases. These are innovations that actually have a huge impact for all diseases, but they come out of the rare diseases. It's not an accident that when I listen to, some of the important developments that have come for not only health, but even in the environment, have come because we've been really working with very small populations. One of the other things we want to do, and I'm having a conversation with Dick about it and some other people as well, is we need to be able to bring high-cost therapies, highly innovative therapies that have a major impact on diseases to everybody. It's no good just talking about equality and equity. We need to have mechanisms that will drive that. Some of the things we're talking about is we're trying to create. I don't know how many of you are around the early days of HIV. The nice thing about being old is you saw a lot of these things that happened then. They had a buying club for HIV treatments, right? Get somebody that's willing to take the risk to say, we will purchase drugs on behalf of a large population, and we will let people buy it. We should have a buying club across countries for these very high-cost therapies at a price that actually can be sold to these countries at a much more affordable level. And with that, we will also develop in diagnostic capacity, we will develop in specialist capacity, we will develop in it, hopefully, the ability to manage and monitor that data so we can learn a whole lot more from it. Quite frankly, I think the companies that are developing these innovative therapies know they cannot survive without bringing everybody into it. They cannot survive their therapies on just high-income countries alone. I mean, I live in Canada. Yes, we're a high-income country. We're very fortunate. But we do not have enough people to actually provide the level of support and development that these companies need. But they're looking for ways in which they can make these therapies available. We need to be able to provide the infrastructure, the diagnostics and support, but we can only do that if we work together. I would like to see some direct cooperations between Asia Pacific and Latin America, and that we can look at things that we can do as projects together.
Gracias, Jorge. Fantástico. Acá
Thank you, Dorhan. That was fantastic. ERCAL is trying to find cooperation, as you said in your introduction, Diego, and I would like to find out um, what ERCAL is doing to support the different groups of patients, the different federations in the countries to consolidate their national action plan, and what is the expectation on these opportunities for collaboration, not only at a regional level, but also um, how what ERCAL is doing about this regard. I think this is, oh, from ERCAL, we have been working closely not only with the patients and the families, but also with but fortunately, one of the main important characteristics of the patients groups is that apart from being um, managers of knowledge and social cohesion, they're articulators, and patients organizations have this power of calling, and we can connect different stakeholders like let's say the governments, regulation agents, of course, the academy, scientific society, the health part, and the academy, which is very important. And from ERCO, what we have been doing is strengthening this collaboration. That the conversation should not be isolated on the population that is affected by the situations, but as Alexander says, the key part to make real this resolution. It shouldn't be like a really nice document on the paper. We should have this synergies, this collaboration, and it is important. And I connect what you said, Durham, is we don't have to reinvent wheel because of the situations that are happening in the countries, but it should be a country that is similar to mine. There are things that are happening that can be replicated within the countries. And in Urkel, we share a lot of information with groups, with leaders, and we promote this discussion spaces, and we share relevant information, and we connect different stakeholders that maybe are aware of leaders in different countries and associated with them and generating this bridges of collaboration. And it is part of the patients of ERCAL groups. And I think that's something that is important to be considered within the organizations. Part of ERCAL is that many of these organizations have been the big promoters, not only from public policies that exist nowadays in Latin America, but also they have been promoters of what we reached in terms of access. These organizations made an advocacy exercise through legal mechanisms and also uh, pressure exercise to make this access to be possible. Regulation processes be in favor of the realities of patients, guaranteeing safety and medications efficacy. And of course, we have been doing with ERCAL to strengthen this association tissue and helping leaders to help other leaders. And these leaders are part of the community, and they need the support from other leaders to find these other people that can take this flag in these discussions, and we can see that this other part could be positive. And what you said, felicitas for this implementation. I was mentioned it before, like we have to try to the extent as possible to connect most of the citizens and people that are not visible in the discussion spaces and connect them to the construction and the formulation of these plans. It is important that this plan, this route that should be going up to 10 years, should show situations that that live with rare diseases, and it shouldn't be a desk plan. But for example, if there is a family that is facing difficulties not only to access treatment, but also from the detection, should be shown in that plan, and we can achieve to reduce this difficult journey. And we have to hear to that voices, especially in territories in which families do not have this opportunity to be visible. So that is the challenge that we have in Latin America. Try to make these voices visible and show them visible within our We have a lot of challenges in this road, um, Diego, and we are opening this many spaces. And I would like to go back to Dr. Fitzgerald if he's online, or talking about cooperation and alliances. It would be feasible to uh, stipulate an alliance with ERCAL or regional alliances to move forward in technical and political areas in the region, or also to talk about how to manage the registry of rare diseases at a regional level that we have been working with support of their hand that wants to replicate that in Asia Pacific for more than a year. We're trying to consolidate a plan to generate uh, regional registry, and we haven't found the best way. Maybe with an alliance with um, yes, and maybe and also with PAHO and access to medication and promoting and managing with an alliance with PAHO regional purchases of orphan medications at the level of Latin America, considering other successful formulas managed by the PAHO, like the Rotary Fund of Vaccines. So, what can you tell us about that, Dr. Fitzgerald? There were many questions in there. Thank you again, Felicitas, for these three big questions in this regard. Again, we can talk about the register. Um, we have to explore that, of course. The topics related to register um, is something complex because we have to talk about national systems, considering that care of the other person that lives with a rare disease has been done at a national and local level. So it is important to strengthen the capacity of a national registry in countries, and regarding these registries, after considering them, how to articulate and how to include all the information at the level of region through a process of articulation and consolidation of information like this. So we have to notice that there are complex aspects in relation to the confidentiality of information, systematization of data, information that should be important to include this and having this discussion to achieve that the countries and the health systems should be public or private, should include in the international regulations in regards of the classification of rare diseases and registries. But that is a discussion that we are open to have and move forward with this topic. So it would be like an important element to consider the other element, which is the access to these medicines that are orphan drugs that have a high cost. What the direction does is approving a resolution for access to these high cost medications for push a little bit forward countries to have strategies at a national level to improve access to well, inclusion, of course, of these medications in this national plans and the collection of benefits and the provision of services, and also determining processes on how to include the financiation of these medications in the country. So, in many cases, this is the protection of different elements on orphan medications and with limited sources, and the PAHO included in this resolution to use the acquisition through the Rotary Fund and the PAHO to mostly for these products. And we have two different funds. One is the Rotary Fund of Vaccines, and the other one is for medications, in which we consolidate the demand of the many medicines, many vaccines in the Americas region with the member states and in the organizations, and we arrange collective purchases, and we have an increased capacity. Our director Barbosa move forward with this topic to negotiate with the private sector to have base or a consolidated demand of many medications and products using the installed capacities of these regulatory funds in the future. So we are talking about this and moving forward with some of these products. All of this implies alliances, and it implies the participation of private sector and engagement between the organization and organizations such as RDA and Cal, and we are open to move forward with the construction of these alliances at a regional level to support the development of this global plan. We agree that as Diego presented a framework for the construction of this plan, that implies that we are working with the member states in the organization, but also with other associates that have an important voice in definition of strategies in this plan. So we are going to talk with Geneva and the WHO to find out which is the roadmap to start the consultation process with the member states at a global level, and also to bring the 6 regional offices of the organization. So we're going to keep this collaboration with you regarding the moving forward to 2028 and the option of a new global plan in this regard. Thank you. Thank you, Dr. Fitzgerald, and please do not leave. And we have some other questions available, and thank you. There are very good perspectives that we can generate, and we can have some more alliances in collaboration with all of you. So, Alexandra, RDI, what are we doing now? What are the tools that you have available? Making more real, practical tools that for the federations to, well, in the world. And also, we are talking about mostly about Latin America, can have some more resources and tools in which we can use to move forward and their projects and national plans on rare diseases.
Thank you, Felicitas. I think perhaps one important point it would be that in the process of elaborating the Global Action Plan, it's to try to work in really in a coordinated manner, to be able to be in one voice. In our exchange recently with the WHO representative here in Geneva, there was sometimes some concern that if each disease specific, for example, each group go to by themselves, it can create a bit of a big how do you say mess. So what is important is to try to go in one voice, and this is what ADI is trying to do by putting together the regional task force in each region. So we invite every members of the region, every regional alliances, when there are several one in the region, to really work together. Because like this, you will be strong and you will be a strong voice to then interact with each WHO regional office, for example, which would be really something quite important. And I appreciate that Dr. Fitzgerald also mentioned that indeed the 6 regional offices will have to be involved once the WHO headquarters here would have developed the roadmap for consultation. And so ADI is really willing to provide some tools or capacity empowerment to our different regional alliances, but also members in the region to enable that input for them in the process of the work. But there is another aspect as well, and it has been mentioned by several of you here, is the fact that actually we have several initiatives in our community that works. Whether or not they need to be scaled up, it's something we need to assess. Whether or not they need to be tailored to the region, of course. But I would say that it's quite commendable that our rare disease community, with the private sector and every type of stakeholder, notably the center of reference, the hospital, etc., there are solutions that work. We're not starting from zero. And this is perhaps this that LDI will help to bring together, to highlight, to inform the WHO representative when they're going to start working on the plan. LDI can also facilitate the consultation, because if there is official formal consultation, we will need again to kind of organize a bit ourselves, to not look as all disparate and everything. So this could be what LDI can bring to our members and the different stakeholders. Plus, there will be also a need to bring some evidence, some data, some knowledge. And again, I think we have some, but we still need to bring more. So that's why LDI last year set up a Lancet Commission on Rare Diseases, where we have currently 27 commissioners, high-level experts, including Johan, that work on really trying to find ways to tackle the challenges of our community. And we have 5 working groups on this. So those working groups are really doing strong analyses, literature research, and they will come with some data that will be able to inform the development of the Global Action Plan and beyond. So this is what LDI is trying to do, facilitate on one hand the capacity of our members, but often, like in Latin America, you really lead the path. You are an example in a way, and Asia Pacific the same. So there are already a lot of things that are happening. The challenges will be to make sure that we vehicle this in the right way to the WHO to be able to have a solid global action plan. And then the second aspect is really the evidence, data, knowledge, the expertise. There are a lot already. So again, it's about making sure that we bring this in a very comprehensive manner.
Gracias, Alexandra.
Thank you, Alexandra. I would like to ask now, Durkheim, what type of partnerships, since we're talking about cooperation, what type of partnerships would you recommend for the region of Latin America? We're seeing that the conversation has moved a lot at a global level, but with WHA, but what other stakeholders would you recommend to bring into the conversation?
Just delighted to see PAHO, Dr. Fitzgerald, take a role in this, because that is important. But even more so, I think I'm excited about the fact that we've got Urkel, who is working on the ground, very excited about the national organizations. We've got Peru here, we've got Chile that's doing amazing work. We certainly have Brazil, we have Colombia that's doing amazing work, as you say. So it's going to have to be not at that level, but more importantly, I think we need practical vehicles. And one of the things we're talking about is, what about registries? You heard that. How do we have registries that can go across the lines? But also we know that registries, as a registry, is no good. I mean, I give you the difference between a registry in Japan. There are 2 different kinds of registries for rare diseases. One is for their NAMBIL. This is for those, really diseases that were identified sort of very early in the 60s, very challenging, complex kind of diseases. They're on a registry. You get that disease in that registry, you get everything. I mean, everything from the point of view of social support systems. They also have a rare diseases that is somewhat overlapping, but not. And the challenge is that many of the rare diseases are trying to get into the NAMBIL registry because it gives you resources. So no good getting identified as a rare disease if you don't get anything. We look at Taiwan as an amazing example. Taiwan, what is a rare disease in Taiwan? Nothing to do with prevalence. Taiwan says a rare disease is whatever we put on our registry. So they have a registry of rare diseases. The brilliance of that is when you're in that registry, again, you get everything. You get the support of the social system, the educational system, the health system, the medication system. Most important, though, is the reason it's there is the Taiwan Foundation. They have worked hand in hand with the government in order to say, we support and we do a lot of the things that you don't do. We will help identify those diseases to get them ready to be part of a registry. So they work in collaborations. And this is something I would love to see, I think, Latin America do. Malaysia, the same thing. The Rare Disease Society works hand in hand with the government. Taiwan, the Taiwan Rare Disease Foundation works hand in hand with the government. This is something that we don't do as well in the developed countries. They don't really care about us as much. The voice here is much more effective because you're close to the ground. You're also willing to roll up your sleeves and do things, but you also can get the governments to listen to you. So don't shoot for the moon, shoot for things that you can do. Take your registry. What do you want to do at that registry? Give us more for those that are on the registry and be able to provide that integrated services. So I'd love for us to share what are the different models of how we're taking a registry, just for one example, what Dr. Fitzgerald talked about, and make it into a reality for patients and families living with rare conditions.
Gracias, Durham. Hace mucho estamos hablando de...
Thank you, Durham. We've been talking about the patient registry for a long time, and we hope that this will become a reality soon. Now, Diego, what's the plan? What's ERCL's plan in the coming 12 months? Without a doubt, in the roadmap of ERCL, the coming 12 months, we have the task force. So as a goal, we want to have the leadership and have the joint lead of that task force and connect with the families, with the patients, with the caregivers in the different territories. That's within the roadmap that we have. Do capacity building exercises, not just for the population that is impacted, but for the different stakeholders, which is something that is part of ERCL's plan for next year, so that we can have this exercise of communication and dialogue. The Congress that we will be having August in Santiago de Chile is going to be a very important conversation, because we're not only going to assess and give feedback on the progress of the different countries, but we will also have that conversation on how the task force is advancing in terms of the things that we can contribute to the WHO in formulating that plan. Now, evidence, we've talked a lot about registry. There are countries in Latin America that have certain registries, some are private, some are public. Data usage and the value of data is very important, because we cannot work for a population that we don't have deep understanding of in terms of data. That's also part of what we're formulating right now in order to materialize it next year. So a lot of things, a lot of challenges, but I would think that these are the three key points that we will address in ERCL. So now, to close the panel, I would like to come back to Dr. Fitzgerald. Now, I wanted to tell you that we extended an invitation to the Vice Minister of Health in Colombia, Dr. Jaime Urrego, but because of conflicting agendas, he couldn't participate, couldn't come today. However, I would like to ask you, Dr. Fitzgerald, from the OPS, what are the recommendations that you would give to your local stakeholders, especially since we're opening the Colombian Congress, the FACOR Congress, Rare Diseases in Colombia, will be starting today, this afternoon. So what are the recommendations in order to integrate the resolution within the health system, and also understanding that it's a Latin American context, that it's very diverse, in which there's a lot of fluctuation in trends, tendencies, and therefore fluctuations in financing different pillars of public health. So it's like the ebbs and flows of changes of administration. Sometimes we advance, sometimes we go back. How can we manage this? Having a valid authority such as PAHO. Thank you for the question. So I think that the mechanism that are developing this type of engagement with us, with authorities, are the right mechanisms. Everything should be done or conducted throughout dialogue to generate spaces for conversation to bring best practice into practice. Making sure that people with rare diseases have a voice, that are present, so that they can have an incidence in policies and the political decisions regarding the situation. As I mentioned in the beginning, and we are doing the, we're closing the circle. Yes, each country is different. The context varies severely, and also the people within each country have a lot of diversity. So we need to have large subnational and national dialogues. When you have federal countries, you have those dialogues at a federal level and at a state level. So it's important to make sure that having this on the table is the first step. And I think that with the activity that you're doing, accompanying and joining WHO is the right mechanism in order to make sure that in the coming years we will have an impact in the countries in terms of decision-making processes regarding diagnose, registry, and treatment of these diseases. Thank you. Thank you to all of the participants who are here today, who are joining us via streaming. This is a very interesting conversation that will carry on to the second panel. So thank you, Durheim. Thank you, Diego.
Bueno, seguimos.
So we're going to continue with our agenda for today. So now I would like to introduce our second panel, which is titled Regional Map for Integration Towards Public Action in Rare Diseases. So I would like to introduce Priscila Torres, founder of BioRed in Brazil. Priscila, can you please come to the stage? We have Dr. Carolina Goic, the academic and researcher of the Pontificia Universidad Católica de Chile. She will be joining us remotely. Thank you, Dr. Goic. We have Dr. Pablo Duran, Regional Advisor for Perinatal Health of the WHO. He will be joining remotely from Washington. We have Dr. Aide Rosas Vargas, Chief of Medical Research on Human Genetics of the Mexican Institute of Health Services, IMS, in Mexico, and Maria Elena Aldemaris, Secretary of the Board of ERCAL. Priscila, so I'd like to start with you. What are the challenges that organizations are facing in Brazil? Patients organizations, what are the challenges that they're facing within the context of rare diseases? Good morning, everyone. So Brazil has a national policy for patients with rare diseases. Sorry, yes, I'll be speaking Portuguese. So I'll continue. So we have a national policies for comprehensive services for people with rare disease that was published in 2014. That policy was built following the social participation principles of Brazil, I am National Advisor of Health. I represent Brazil in the National Health Council, which is a participation instance where we elaborate policies as well as approve the budget for health systems. We also conduct auditing, and the policies go through this council. Just like in Brazil, we have participation of social foundation of our policies. However, rare disease policy was put together with all of those social instances participation. We have 10 years of story. And with that, we've been trying to update that policy for the people in the country. Brazil has centralized care of rare disease through clinical protocols and therapeutical matters. So it's an open policy, and we only have 47 clinical protocols and therapeutical guidance that refer to rare diseases in the country, and this generates inequality because when there's a clinical protocol from the health ministry, that protocol comes together with financing of the service, and it's a tri-party matter in Brazil, meaning all of the federal entities. So you have the federal, the local, and the municipal levels. We have the obligation of decentralizing that care because we have 27 federal institutions in a very large country. So as much of the national policy for rare diseases, it becomes polarized into centers, and so not every city has that. We need to decentralize, and we saw this resolution from the WHO. Brazil was signing member state. I was part of the official delegation of my country. Unfortunately, the resolution was approved on a Saturday, and we weren't able to be there because we had a flight that day. But the Brazilian diplomacy was there. It was signed by us. And we saw this resolution as a great support to have this political force within the Brazilian context. So, yes, there's a lot of similarity with the rest of Latin America. Absence of data makes us not have protocols for every single disease. When we are going to assess and evaluate the technologies for health, I am part of the assessing committee when we're going to have a discussion about new drugs or treatments. There's a lack of data, which I think is similar to what happens in the rest of Latin America. Now, regarding public policies in Brazil, you're at the forefront. Brazil is at the forefront, so it's a role model. Now, Doctora Rosas Vargas, what are the challenges that you consider that the health system of Mexico faces regarding integrating genetic diagnosis in public health services? How can these matters be discussed at a regional level as well? If Mexico were to present a best practice or a model that you're implementing? Well, first of all, thank you for the invitation. It's an honor to be here, being able to share your experience. For us as a nation, it's a particularly large challenge. To give you a context, we're 132 million citizens of Mexico, and we estimate that there's 8 million people that have a rare disease in Mexico. It's an estimate because we don't have a registry. So we have a fragmented health system that, while the government is trying to unify it, we cannot wait for things to be done in order to be addressing this public health issue matter. And now within this context, it's also important to mention that within the larger population and within the whole of the national territory, as it had been mentioned, the health services are concentrated or centralized in certain cities. So it's a privilege for some. There are large rural areas. for whom the health system is not something that you have access to immediately. So common diseases are a challenge right now. So when we jump into rare diseases, it's even a larger challenge. Now, regarding genomics and diagnose and what it has to do with rare diseases, that we know that there's a lot of genetic information in this population. It's something that is just starting. So in the IMS where we work, the institute that I work for, and we need to serve 60% of the population. There's no program right now in any institute in Mexico that covers this need for molecular diagnosis. And we know that 80% of rare diseases are of genetic origin. And so what has been done so far is taking resources from research projects and also a little bit hand in hand with the pharmaceutical industry that support with certain diagnoses that have been selected. And we've been trying to meet these need or the needs of many patients. We're working very hard hand in hand with the authorities so that this problematic can be addressed. And we can offer this service for all the general population and costless or free of charge to the whole of the population. We will start with primary immunodeficiency, but that's just the first step. It's going to be a landmark through which we will be able to broaden the offer of the services. An example that we can offer now, it's precisely this. We're working in the institute. It's a network really that joins wheels experiences of our clinicians, researchers, biomedical researchers, and authorities, always starting from the patient and cooperating with the pharmaceutical industry in order to find solutions through research, through dialogue, being able to open a registry so that it all comes back to each of the patients. Thank you very much. And now, yeah, it's not just regional challenges, but also landing them at a national level. Now, if Dr. Duran is joining us, I would like to ask him, are there any recommendations from OPS in order to broaden neonatal screenage in the region? Now, also promoting everything that's being done on a regional level. Thank you very much. So thank you for the invitation. I congratulate you on the event. And now, highlighting what Dr. Fitzgerald mentioned in the initial panel. So from the OPS, we're working in strengthening the programs of neonatal screenage, and this is joined to the registry and surveillance systems. So since 2016 in the region, the OPS started a path in order to strengthen screening programs in the region. So Dr. Diego made a reference to countries such as Chile, Cuba, Costa Rica, and Uruguay that started in the 80s, 90s. Unfortunately, today, many other countries that face different challenges, that have different degrees of coverage. So, for instance, Colombia, Brazil, Argentina, Peru, Ecuador, Bolivia, Paraguay have developed, have taken gigantic steps. So there's experience that's been built. But fundamentally, what we're concerned with is strengthening screening and understanding what's the availability, because we want to make sure that from a rights perspective, we want to guarantee screening. And in the context of this disease, you have the result of a democratic exercise and its bond and connection with scientific development and citizens' strengthenship. So we've conducted a mapping in order to identify the availability of legislation, specific programs, the reach and scope of each of those programs, and at the same time, what are the financing sources, the labs in order to conduct the screening, and the availability of surveillance systems. And this clearly showed that there's differences between countries, and the role of OPS is to accompany and support the development in the countries. We've been working with the countries. We had a regional meeting in 2016 that allowed us to identify the limits, bottlenecks, and lessons learned. And this concluded in the need of elaborating a regional guide for neonatal screening, in which there all the differences of the countries have, but as I was saying, based on the availability of resources and labs and so on and so forth, we have advanced and progress in generating this guideline that has the purpose of providing evidence and consolidating from a process of evidence review to provide support to the countries so that they can have programs or screening programs that are well informed and that are evidence based. We're in a last stage of approval. It was approved by the WHO guideline committee. As a matter of fact, 19 diseases, 15 neurometabolical, but there are also structural like hereditary cardiopathies, and also sensorial anomalies. And the idea is that from that guideline, we can provide support to the countries in the implementation and formulation of surveillance and registry systems, as it was mentioned in the morning, that also are encompassed with the registry of congenital conditions that has been promoted in the region. So I think that these are the overall aspects that we can later discuss. So I saw that Dr. Carolina Goic is joining us from Chile. So Dr. Goic, if you're joining us, I have a question. Since we are talking about legislation now, and also giving context of all the breakthroughs that Chile have taken in the last year, have made in the last year, especially with the approval of rare disease bill that was passed, also involving the advisory committee, having FECHER, the Federation for Rare Disease of Chile, as a crucial voice. And now, since Chile is going to be hosting the third Congress of Rare Diseases in Latin America and the Caribbean. So a lot of steps, really quick. You've been moving really quick. And you've been advancing in a very important regulatory context. Now, from your experience, Dr. Goic, in your experience with legislation, what's the ideal context for regulations in order to, or understanding that this has been permeating in Chile? What's the ideal regulatory context to guarantee the rights to the people with conditions of rare diseases within the framework of this new resolution?
La doctora me dice que se ha desconectado del Zoom.
So unfortunately, the doctor is not connected anymore. So now, Maria Elena, what are the strategies that ERCL are leading regarding the roadmap of consolidation of all the aspects that the resolution proposes? So, good morning, everyone. We have a lot of activities that are very interesting. So, we are all very motivated So first, we have conceived doing this relay of information for each of the countries, at least starting with 10, and then mapping in its resolutory context in order to implement the resolution. So what Doran said regarding society being able to contribute and filling voids that the government leaves, I do believe that we can build from Mercal epidemiology. We're not talking about registry of patients, but we do have the capacity of presenting the epidemiology of the countries that are adhered, that are signing the resolution, so that we can present certain types of surveillance, monitoring, and advances in progress in treating diseases that are replicated to some countries, because there's no single country that can address every single rare disease of their country. Maybe you can start with the most prevalent, but in cooperation and in integration, we see the only way. And I think that in that sense, we've been able to generate as many partnership with as many stakeholders as possible. And I think that in the regional epidemiology, in generating partnerships, also saying that what we've been doing with our governments. And doctor was talking about neonatal screening. I see that in Brazil, the registry is over 60 disease. In Chile, it's more than 60. In Peru, we've seen over 60. But let's be honest, as a civil society, how many have really implemented? So Brazil to Peru hasn't started. Chile, there's no advance there. But maybe we're seeing that we're looking to other countries. So why Costa Rica has over 25 that have been executed in a year and a half? A year and a half. They went from 10 rare diseases to more than 20 that are being screened at a national level. So we need to tropicalize and execute and injecting resources so that this happens. We have Jacqueline. What did Quintana Roo did in order to reach this neonatal screening that's so broad? So it has to do with looking into the perspective that every country has. So it doesn't matter the country. Every single country has something to contribute in order to improve the other countries, and so that we can tropicalize the road. And sharing is key within the organizations of ERCO.
And being able to move forward on implementation. Well, thank you, Marilena, and we've been working. We have been working with different work. Priscilla, I would like to come back to you and your experience. What are your recommendations, or what are the best practices that you had regarding cooperation, integration of different voices within a common work agenda, and the collaboration that we are discussing about the importance of the collaboration of different stakeholders that at first seem not to be that integrated in their voices, but we have a premise now that is clear on what is the way to go to. Well, I'm going just so during the World Health Organization on 2024, Brazil was the example of social participation for the resolution of social participation of the World Health Organization. So we created a group that is the main group that we work together in the same group because due to the removal with the taking the retreat from the U.S. and we started talking with all of these countries, members of the WHO that had a minimum sense of social participation similar to Brazil, or at least they had an initiative to be or to have an initiative of social participation working with the health system, and that is the social participation in which social participation together with the government, heard to those voices, and try to have this politic or political organizations. And one thing that I've learned is that our organizations with the diplomacy with other countries, we know that we have countries that are part of our countries, and we represent those countries in the WHO. So when we and the Minister of Health, of Vice Minister of Health, cannot be part of a plenary, what instances of diplomats can take part of it? And when we talk about with politicians, we found out the reality of those people living in those countries who are part of this, because many of them do not live in our countries, and they're part of these zones. So to guarantee the participation, social and sustainable participation is linked to that situations, to organizations, and it's important to strengthen these governance mechanisms. And I think that it is important to correlate to those organizations so with other resolutions that have been and put forth in this moment. So we have the resolution of social participation, and we also have during the fourth with non-communicable diseases, and um, we started to have this social participation because I link together with the declaration of non-communicable diseases, together with the government through the public management, is there were not like ways to find out that the governments should include those people that have the situations with these diseases, to find out what's their perspective of needs, including of those non-communicable diseases, for example, and having those communities and all of the situations that they have, and moving from these countries that are part and that they include these resolutions to join forces and be together. So this way, this organization should be between meetings and having these situations, because we don't have, there is no mobilization regarding these illnesses and non-communicable diseases, and we have that many movements and part of those resolutions. So everything would be transformation and recommendations, and we have they can have a voice in their work, and there will be an opportunity of parallel events. And we think, well, we think that there's something that should be proposed. We think the WHO and being part of those countries that can co-sponsor and help. And in these countries, we need to determine which are the politicians part of these missions and giving them our perspective, because they represent the diplomats and they don't know how these people are living in these areas, in these countries. Thank you very much, Priscilla, for your experience. And well, if there are some other more into these people part of this or stakeholders part of those that we should to Dr. Denan is already online. Is it still online? We talk about registries of patients, um, the dynamics, or the support and neonatal screening, and the WHA. And we would like to talk about topics related to medical education and training of professionals regarding rare diseases, and the research and innovation technology, surveillance, and all of these topics that we want to talk about on a regional level, and your perspective from where you can provide your opinion. It is important and necessary, as the colleague said or mentioned it, that there is an echo on the background. That if there is a decision from the countries, and after that the implementation would be executed. So because we know that having or considering a law or a program does not ensure that after that the implementation and coverage should be the desired one. So from the how we work strongly in the training and advocacy, and also informing of creating work groups. And we are convinced, as you mentioned it from the very beginning, about the importance of the interaction between decision makers, multilateral cooperation, organisms, scientific societies, academic groups, and experts, and also donors and the civil society. In this regard, from since starting last year, and from the meeting held in Colombia last year with experts, led us to discuss about guidelines, the Scientific Council of the WHO discussed about genomics access for the global health. This council of scientists from the WHO promotes the use of genomics and is strengthening dialogue in the country. So, in this regard, this first meeting of experts led us to discuss with experts in with different experts in the region to find out recommendations to expand the access on genomics use, and it includes the training of human resources and also from postgraduate and degrees, and it shouldn't be out of the policies the government states in this regard. So we have been working with with the articulation between decision making at a governmental level, together with the strengthening actions of education and research in genomics, having ethical frameworks for the um, genomic events, standardizing clinical practice, diagnosis, and treatment, and clearly moving this to educational programs that would allow to promote and strengthen education and genomics, clinical capacities, and laboratories in the region. The Americas region has experience from the point of view of professionals, as well as equipping and working in network, is from the point of view of the region and the PAHO, which we are working with these experts of 19 countries. In this regard, this meeting started as a from this meeting we have mapped we started mapping in an advisory committee, establishing course of communication and also tools that are available, exchange of data, and strengthening capacities. And concretely, from this meeting, we started the design of a virtual course in general terms about the use and possibilities from genomics for the diffusion between health teams and the topics related to um, and it is in under development and is going to be included in the PAHO virtual space, and it is a tool that is really useful because we achieved 2,000 million users in the region, but also outside of the region of the Americas, in topics that are varied, but also include the advantage of, on one hand, that it is free, has free access from the users, and it includes topics that from the PAHO and WHO are priority, with notes in the countries that allows not having only regional courses with generic characteristics, but also in many cases courses at a level of countries and north, allowing particular actions and policies in this regards. So those are the main aspects that we have discussed in terms of training with human resources and the use of technologies, and also in terms of advocacy and strengthening at an institutional level. And we showed 10 prioritize access and terms related to policy, perinatal topics, in which training of human resources and taking care of newborns and and illness. We started with guidelines for the countries to be adopted, and also at the same time the guidelines for the preparation of a roadmap from the countries can prioritize and make and start with the stages moving forward to the talking about rare diseases, congenital defects, and other conditions, and the training of human resources. Thank you, Dr. Duran. What you are doing from the PAHO and the WHO is interesting. Would it be feasible to have meeting in the context of the following context with the different stakeholders to talk about how to move forward in the region? Of course, we could have it. Sure. That is what we are trying to integrate nowadays and integrate voices. So they're starting to generate more enthusiasm within the things that we are going to do in the next year. So, Dr. Rosas, can you please tell us from Mexico, do you think that Mexico can take part of as a leader in the region, as a scientific leader in the region, if you can share some best practices or some success case that you had from the INS that can be replicated to other parts of the region, and how do you see Mexico in this important role of that we have and these new guidelines and for Latin America? Well, I would like to talk about the last comment from the doctor, because in Mexico we also have an interest in the to implement access to genomics for all of the population. So recently, and in parallel to what the doctor mentioned, we signed the Malaga Declaration that maybe you are aware of, and it is focused on genomics, in which the group of sig- of the participants is Colombia, and if I'm not wrong, it is Brazil. And we also have the representation of human genetics in Mexico, and RELAC, which person is Elias Garcia, which is a Mexican person. And we discussed that with them, and we are going to try to find out our authorities to make a position in document and being able to take that as a national plan and concrete these proposals as mentioned. It is really interesting that it should be on paper, but then we should take actions to implement those plans and make them a reality. So Mexico is not outside of this idea. So regarding an example that can be useful to replicate a regional level, I'm not aware what is done in the countries, but in social security Mexican Institute, we have a division that is called the Clinic of Excellence in Health, and from there we managed from about 20 years ago clinic of lysosomal illnesses, and we coordinate the registry of all of the patients that are diagnosed and supported with diagnosis of precision, the confirmation. Then we manage the replacement therapies in a systematized way, so no person will be lagged behind. And we manage also group of experts, and we coordinate with them that periodically review the practical guides at the clinical level in terms of needs or improvements. So we talk about the wide coverage of the institute, and also with this group of experts, we review cases of bad diagnosis, and we know that all of the cases are not part of of the books, and we provide a special attention to those that require them. And I think that is a model to be replicated for other groups of illnesses within our institute that can be replicated at regional level.
and make groups that should be wide for collaboration. As Marilena mentioned, it cannot be included. Everything should not be cannot be included. We should take advantage of those that have already a path. And I think that to conclude, Marilena, from ERCAL, what are the standards that basic minimum standards proposed by ERCAL to move forward with public policies at a national level, and how are we trying to avoid this being only in a paper and to make real these wonderful ideas and plans from the perspective of a society, and we have been able to see in different countries. I think that giving a look on the country that is not moving forward in the literature and also in the implementation, that is what we mentioned. Why Costa Rica, why Quintana Roo move forward with this screening and neonatal screening topic? Why there are municipal interventions in Brazil, door by door? Or the effective participation of the society as the board constituted in Colombia or a supreme um, decree in Peru on the implementation of public policy. There should be the formalization. Also in Chile, it was included to formalize the participation of the society and different stakeholders in a sustainable board that should be more than from government to government that impacts us in the context of the region to move forward and materialize because we know that there are many things that are on short and medium term. So you mentioned about implementation of policies. What were the standards that proposed by ERCAT? Well, we are building a database of governance not internally at ERCO, but as a proposal to for the participation of federations and multiple stakeholders. And many countries do not consider participation of all of the stakeholders. We see the mindset that is open in Brazil and the participation that is widely open from the health secretariat and from the pharmaceutical industry or private companies that are not binding. That is not something that happens in other countries. We have to start building like work construction on a wider spectrum, including diplomats, and that also fiscalize the implementation of the policies because there are many boards at an international level in which you are accountable in relation to human rights, and they do not discuss anything about rare diseases. So we have to open this participation, stakeholders, and what the proposal is to have some standards and ethical codes that on the next Congress we're going to show the next improvement that Alejandro showed in the relationship that is a multi-stakeholder to move forward in this region, in this regard. Well, thank you very much. I don't know if anyone has a final comment or otherwise we can close the session. I don't know if you, Mr. Duran, Dr. Duran, have another comment? Well, no, briefly, I would like to outstand the place of the families, and that from Bajo, we work with that, working in groups of families or with babies with different conditions, and working with the families and politicians, and there's some regional forum of parliamentaries, and that also helps us with these two ways. Civil society providing their voice from legislations that provide a framework of sustainability and other access that together with formative actions are going to support this achievement. And from PAHO, we work with that and close with the availability to articulate and work with all of the stakeholders to reach more coverage and access to technologies and exercise of rights. And with this, Mr. Dr. Duran, we close the second panel. So we thank all of the panelists who were able to get to Colombia, to Dr. Dorando visited us from virtually. I mean, and the audience that is still with us, paying attention to um, line and here presence. So we have a coffee break now for 20 minutes, and we will start with the last panel after this break. Thank you.
is so good. So for this final panel, um, I would like to invite the panelists. As always, we're joined by Diego Gil, the chair of ERCAL and FECOR. We're going to have Alejandro Andrade, chair of FECHER, the Rare Disease Federation of Chile. He'll be joining remotely. We have Maria Elena Almendaris, secretary of the board of directors of ERCAL, Felix Galarza, chair of FERPOF, the Ecuadorian Federation of Rare Diseases. He will also be joining remotely. And we have Jacqueline Toa, chair and founder of Pensemos en Cebras, a patients federation in Mexico. So I would like to invite you to the stage, to the panelists. So we're going to continue the conversation, and we're going to now delve into national territory. And I'd like to start by asking Diego, what part, now that you have this position in FECOER, and so I know that there are many challenges. What can you tell us about that? So right now, we're facing one of the most complex crises in the Colombian health system has faced. While there are structural challenges such as barriers for early detection, diagnosis, difficulties to have a comprehensive treatment, we're seeing a crisis of lack of funding in the system. I think that all the world health systems will always need resources, a good source of resources, in order to meet the needs of the population. In the case of Colombia, I think that we're facing a very difficult situation regarding resources because they're not enough, but those resources are being transferred opportunely to the different stakeholders. There's a history of cases of corruption within the system, and I think that a lot of the countries in the region have experienced this. It's important to mention that that's not the rule, it's not normal, but yeah, lack of transparency and mechanisms erode the trust in many of the cases. So we have a big challenge. We have an enormous challenge in not just finding new resources, but also alternatives and guaranteeing transparency in the flow of resources. Also improving access mechanisms. There are different strategies that can be implemented to improve, especially with new treatments and technologies. But it's possible to do it in the context of low and medium income countries, and I think that Colombia needs to lead this discussion in order to be able to. So Colombia in the last 30 years has been able to have or expand the possibility of access to patients. So it's important to continue supporting this, continue advancing. There's a lot of research, there are a lot of therapies that are available for the population. So I think that's one of the ways that we need to continue exploring. And I would like to close out by saying that communication is key. We can no longer be just the civil society. We need to communicate with the rest of the stakeholders. And the policies that are developed or established for rare diseases as a population of high vulnerability, they need to be not just an administration policy, but a state policy. So any single decision regarding public health should not have a negative impact on rare diseases. Thank you, Diego. And yeah, we were talking during the break a little bit about sustainability and public policies and support. And this is something that I would like to highlight because it's something that was happening to Colombia after you've been leaders regarding rights and legislation that had been achieved, and now it's like taking a couple steps back. It feels like it, and that happens a lot in this region where we have a lot of ideological polarization. And I would like to now go to Alejandro Andrade from WHA. Is he connected? Alejandro, I would like you to tell us, how is it that Chile has progress? So this is a question that I had for Dr. Goik, and I'm really sorry. I need to apologize because we have had delays with the agenda, and so she wasn't able to stay here. So this is the question for you, Alejandro. How has Chile advanced with the approval of the rare disease bill, with the fact that you've been invited as advisor within the context of the commission that was created, also as hosts of the coming Congress? I know it's a lot. I can see you smiling, and we're all very pleased of everything that we are seeing in Chile. I hope you can hear me okay. Sorry, Alejandro, we're not. There you go. I'll assume you can hear me and I'll start talking. So in April 25, the bill was approved, so it creates an institutional framework that will allow us to develop public policies. But the fundamental thing about this bill is that it consolidates the participation of civil society in public policy. So it's a representation of 4 people in a table of 12 people. 4 from civil society, 4 from the academy, and 4 representative of the ministry and the decision makers. So this is a breakthrough as a country, because what we've done is changing how we design and make public policy. And we've consolidated, or we coined the term AirPoc in order to define rare diseases, not just because of prevalence, but also because of the difficulty in diagnosing them and treating them. Certainly, we've been advancing, but all these advances just make more evident all the other things that we need to improve. So right now, there's a bill regarding financial protection, and that generates or establishes limits in scientific research, which is really important because our patients cannot have access to these trials that are being conducted. We're very happy because it's a landmark, and we will be happy to have you next year in our country. We will be able to discuss, to talk, and see how is it that we can transform all those public policies into a reality. How is it that what we have in our table we can make it a reality? So yeah, and ERPOC has been key in this. Yes, all the patient leaders also have you have your agenda, you have your work. So thank you for taking the time. But please don't leave, because we have a couple of questions more for you. Now, Jacqueline, let's look at Mexico. What are the strategies that have worked, to your understanding, to advance public policies regarding rare diseases, and what are the strategies that might work in the future within the context of regional cooperation and national corporation that we're building. Thank you. First, I would like to thank for the space and the invitation to the organizing committee for making this possible. I would like to congratulate especially the countries who participated in the resolution, Egypt, Mexico, Colombia, because it's really inspiring, and I think that's what we were missing and we were lacking in the region, which was cooperation. So yes, while we are working in our country, public policy and having advocacy and incidents with decision makers, and having the patients and their family not just as recipients of something, but also as an integral part of creating and developing systems. I think that in Mexico we have and we've had an impact in early diagnosis, and while rare diseases are a whole ecosystem, and talking about that has to do with rehabilitation, but we have first, second, third level of service. But it's important to identify how is it that we can arrive on time, how we can eradicate diseases, how can we accompany the patient and their families better understand the condition and provide continued accompaniment. I think that legislation in 2012 really helped us because we worked in having an impact on neonatal screening bill. It was a bill that had no budget, but we were entirely convinced that this was a significant step. And while the legal bank is important, what's most important is that this is implemented and becomes a reality, becomes something tangible for the population. And as Maria Elena was mentioning a while ago, and also complementing what Dr. Aide from Mexico is saying, in Mexico, thanks to the legislation, we were able to continue having an impact, positive impact, and we were able to broaden the panel of detection, the analitos, we call them. It's not diseases per se, it's like analytics. So Mexico progressed in a decade. So the neonatal screening started in the 80s, and it's only been in the last 10 years that we've been seeing advancement. So yeah, it's cooperation with the organizations, the patients' organizations, and all the different stakeholders. And yes, it's a matter of budget, but also surveillance. And this is something that we need to, this is only the beginning, as they were saying. And something important, which I think is part of the panel, we want to mention that 13 years ago, we proposed to establish a specific chapter for rare diseases. While we have infectious, non-infectious recognized, we were asking where is a place for us, because there's place for everyone, right? And so we wanted to have we wanted rare diseases to be part of it, part of the discussion, and now we've generated this visibility, and this is how we've been able to have certain pressure, relevance, including it, bringing it to the table, and to our representatives of the Pan American Health Organization in Mexico, so that this is brought to a larger stage. And yeah, so we talk about screening in 2016. That was 7 years ago. So how is it that we're going to coordinate everything so that we can continue monitoring, so that when we conduct a census of what's happening, the surveys, we have robust information so that as a region we can continue raising our voice up. I think it's really important because in ERCAL, that's one of the challenges. The first Congress generated regional data of the countries members of ERCAL to set up a baseline so that we can start understanding. And I think this is going to be very interesting. This is going to be the third year, the third point of data at a regional level. And it's going to be very interesting to see how this curve is appearing? What's the trend? Now, Felix, if you I would like to ask you, what are the expectations that Ecuador has regarding the approval of the WHO resolution, and what's your perspective on landing it at a national level in Ecuador? Oh, sorry, I'm being told that he's no longer connected. So the same question, but with Peru. You have a lot of experience. I know that you're not directly you're not directly part of the federation, but what's your perspective, Maria Elena, in Peru? I believe that the way in which agencies of the UN work for our countries is that we include rare diseases chapter in the PUD of the development plan of the UN in each of our nations. In Peru, there are 26 UN agencies, out of which one of those is WHO, and there are specific activities in articulation for Afro-descendants, disabled population, and in the plan of sustainable development in Peru that will conclude in 2027. So that's the time where diseases can be positioned in the strategy and the chapter of FUPAD and the UN, so that we can have a national landscape, so that we can see what are the gaps in Peru compared to the recommendations of the WHO resolution. But I think that it's not only for Peru, because it's the local mechanism for participation that we need to consider. So, ERCAL, we have a lot of knowledge of each of our countries, but it's ERCAL's responsibility to provide a more contextual report so that we can have a real regional landscape regarding policies, scientists, screenings, some ratios that will allow us to have a resource to build information, to provide it to the regional, local OPAs, OPF, and decision makers. I think that's the way to apply the resolution. Thank you, Maria Elena. Now, Diego, coming back to you, what criteria should a roadmap have? I think that a key roadmap, I would like to present the Colombian example here, because I think that we were able to set a national management plan that was very good, because it was able to, it was consolidated with the different stakeholders in the country. And patients' organization provided significant resources. So first, risk management focused on early detection, precise diagnose, and add effort, right? Accurate diagnosis. Second, working for access and services, and I don't mean just the treatment, the drugs. I'm also talking about technologies. I'm talking about services, because a lot of times patients have other needs, and we have the caregivers, because many times we have caregivers who are not being taken care of, and that is also crucial. A third vertical, it should be citizens' participation. Maria Elena was mentioning in the previous panel. These participation instances have to be formalized and they need to be regulated, there must be a guarantee that the voices of the different stakeholders are represented, especially of those who are the most experts, who are the patients and their families. Fourth place, all the efforts in knowledge management. There's a lot of there's a lack of awareness, and it's important to inform and educate not just doctors but everyone involved in the healthcare system, nurses, assistants, and I would like to close by saying finance. So we don't need to reinvent the wheel. There are countries that have similarities or that are comparable to the countries in our region, so Brazil, even countries within the regions. It's important to take reference, to take note of those alternatives in financing, building trust within the sector, especially with the government, in order to advance and materialize those financing actions. I think that those are the verticals in a roadmap that we should have. Yes, Diego, and I would like to add not just financing regarding access to drugs, but also access to all the initiatives, meaning with government and all the forms of financing that are being implemented in other countries, but also breakthroughs in other countries, platforms, networks, everything that you're doing regarding the advancement of federations at a local level for patients groups, so financing patients groups. So Felix, I can see that you're back. Thank you for joining us. I'm going to ask you two questions. I would like to know, in Ecuador, what are your expectations regarding the approval and the adoption of the resolution of the WHO, and what are the barriers that you've faced to develop all the implementation of these recommendations and advancing in the matter of rare disease? Good morning, everyone. Thank you for the space. I didn't hear the first question. Can you repeat it? Yeah, what are your expectations at a national level regarding the adoption of the resolution of the WHO? What are you expecting to see in Ecuador? So in Ecuador, we've been direct actors in this resolution, so we want to present this resolution to the whole of the ecosystem, to what's happening at a global level. So we've been promoting in Ecuador this resolution because we know that it's non-binding as such, but if Ecuador is a co-sponsor of the resolution, it's important to adhere to this resolution as such. So our work in to that all the different areas of the state know about it and understand it. And it's important for us to be working at every single instance, and this is going to be to make us in Ecuador, it's going to put us in the map regarding rare diseases, because since 5 years until now, we've been starting to have that discussion on rare diseases as it should be. So this resolution is going to be the starting point to achieve many goals, especially for those who have rare diseases in Ecuador. And the second question, political barriers. So what happens is that because there's political instability, there's a lot of changes in the administrations to the people leading the health sector. So we can talk to a minister, and then 3 months later there's a change of minister, and so we need to start from scratch almost once there's a change. We have the registry for rare diseases called RUA, it's stale, it hasn't moved, it hasn't been updated, there's no database. And so we cannot go to the authorities and tell them, look, we believe that there's 100, 200, 300 patients. We need accurate data, which is why we're always looking for reference. How is it that other countries made it possible for rare diseases to be included in the agendas, in the public policy agendas? Because we cannot just start making things up and saying like, look, I need treatment for 30 patients of 40 different diseases if we don't have precise or accurate data. As patient organizations, we do have data, but it comes from the organizations, and these instruments, we provide them to the Ministry of Health so that they can work towards it. And so, yeah, there is a lot of issues in the public arena regarding that, but we hope that we will be able to integrate the whole of the health system. And yes, it's important to know that rare diseases are not just being considered in the country, but at a global level, they're being part of a larger discussion. Thank you, Diego. And now regarding, it was very important regarding state policies rather than administration policies. And so we will be reviewing next, Congress. Jacqueline.
How do you see that? Well, the same question. Is the context and the improvement on public policies going to improve regarding rare diseases in Mexico? Mexico is a place in which a region we consider that has a lot of resources, talking about financing, talking about size, support. So it would be a model to be followed if we could generate some kind of formula, master formula, in which Mexico could lead the region. Thank you, Felicitas. Well, effectively, we are 130,000 million inhabitants in the country, so we well, there is no way that we can get a formula from some. But it would be an important thing to train the population, especially those people key in the strategy. And what is the resolution about? There are some other declarations, universal declarations, includes even regarding the high interest in the childhood, the right to be screened and assisted, and we should take this information specifically and clearly and understand what is this resolution about and how this part is important, and it is part of our countries. And as mentioned here, many leaders of the countries regarding rare diseases, we've made a lot. But if we start organizing ourselves, talking about Mexico, because we haven't achieved to agree with to establish a plan of rare diseases because of that complex situation we mentioned about Costa Rica. Costa Rica has an important model that should be followed, and for example, to say that we have complexities in number of births, the amount of population, faraway regions, and also I think that almost 2 million of births we have every year, so everybody should be guaranteed with a screening and coverage. We have 5 screenings. We have to determine what is the expanded screening that includes which are the analytes that can be followed, and the screenings on congenital, cardiac, visual, hip, and auditory that discuss about any type of anomaly that is going to be shown in the future, usually. And we want to have this window for prevention to reach them easily or before. And what we try to find without the access, there wasn't a law imposed that way, is that we should expand the coverage, and there should be a universal the screening home log for the entire country, and we still need 51% of the population to reach that equality. And in the resolution includes equality for everybody, and mostly inclusion. So we think that we have a lot of support that it happened during this time. We are aware that we are working in Mexico from different sectors to build a national plan of rare diseases. We are having a lot of work, and it is not from one day to the other. We've been working there for a lot of time, but we are always in the conversation, so the agenda will not be one way or the other pro-government, but also stays there, and then there should be a continuity. But the public servants could change, but as well as civil society is always there, following and monitoring the agenda updated. And one way or the other, we are achieving that specialists in the topic related to research and financing in different boards of attention should be discussed and propose the possible solutions to long, medium, and short terms, and that would be national plan of rare diseases. As Diego mentioned it, the plan is who's part of A, B, or C, and we said where are we located in B, but we don't have any registry, or maybe we're in the part C. So if we are all identified with this guideline, with this statement that without any doubt we can identify which are our strengths, our challenges. This way, in an arranged way, we can take the information down to decision makers and to the population, because our families deserve to know what is this related to. Maybe sometimes there is something that we can say, what is the benefit for me? How the work has been done from. Well, then I think that from the first time we joined to different countries and the improvements and enlighten year by year, work every day, that way is going to strengthen us. And on the side, I can say, since there is a lot of leadership from Colombia with Diego and the team, and also with Erkan, and this way we should take advantage, so there will be a bridge in the starting point of an after and before the resolution, before and after the resolution, and we should understand what is going to happen. Well, the idea is to continue with the dialogue and continue improving on the regional dialogue and talking about national benefits. I would like to talk about sustainable financing. You were there, part of the experience in Peru, working with ERCAL, organizing all the previous congresses at AHF. It's a challenge, a big challenge that we have, mostly in sustainability of what we do. And I would like to find out what are the strategies to take down the cooperation and commitment of all of our stakeholders. I can see that we have a regional challenge, an economic challenge as well. Since there are countries as Uruguay and Brazil with a GDP invested in health that is about 9 or 10%, the exact reality, if we compete with an European or North American country, the level of import, it would be 50% of what a system gives for a health system, and it generates important challenges because of our economic level. There is an important investment, but it's half of the import that we should include. So there are many ways and many congresses. It was mentioned at the Rotary Fund, that was mentioned by doctors, the catalogs from WHA, and that also it shouldn't be like for the latest technology or other products that have been there for 8 or 10 years, that we should buy them collectively through the catalogs in the WHA. We have a medication, for example, in the catalog for the WHA for rare diseases, just one. So we should include that as a mechanisms, and there should be a every semester purchase mechanisms to find resources, for example, from different sources. We found out in Germany, for example, for the WHO, the implementation of Netflix Amazon support. Every country has local companies that can generate coverage at a global and regional level. We were able to see coverage in Colombia, goods plus service, even financed by a petroleum company. So we have a lot of opportunities, and these positioned companies in the faraway or distant zones, and we should demand them like a situation for cooperation to cover and specialized attention for those patients. For example, in Peru, we have 9,000 million of money that is not executed, and those and the rest of it, we just spend 1.2 in health and 2.4 in education. We are not talking about a little money. We're talking a lot of money. So there are opportunities. So the funds for rare diseases will come from the sources. We have to go there with purchase mechanisms, not only as said agreements to access here, like MDAs or whatever they are named in different countries. We have to start working in that in our countries. And as but every country should learn from other countries. And Brazil is in the future, or every time the biggest country teach the smaller one, and the smaller one to the biggest one. So we can see the Constitutional Court in Brazil. The medicines should be accessed through the list of essential medicines. And I said, wow, with the strength from Brazil, why did that happen in there? And I can see that the Peruvian court says that you have 15 or 30 days to be included in the complementary list of medications. We have to be together, and those stakeholders that have the same rank, so they can see the compliance. And every time a small country can teach the biggest one, and the biggest one can teach the small one. But what we have to put in the middle, and as the Supreme Court says in this sentence, not only important not only for Peru but also for the region, every day counts. Every policy, every decision has to have a time, registry, evaluation, to deliver the diagnosis, and then the time to access coverage or the purchase of treatment. So we have to start establishing policies with response times to access in reality to health. Thank you very much, Marilyn, and I would like to go back to Felix, if you were there. Talking about resources and the platform that was managed from ERCAL, and for about 3 years since the moment you started, that it was 2 years ago, I guess, from Serpov.
¿Cuáles son los beneficios de
How do you see which are the benefits to belong to ERCAL as a platform, and how would you like that ERCAL provide we give support to the national action of each country, and talking about that from Ecuador, let's say, in your case? Thank you, felicitas. As Ecuador, we expanded in regional impact since the moment we started with ERCA. So we can see that this collective work, when we join forces, a criteria that we all agree in the similar needs. We consolidated this base as such in the region to count the expertise of many other colleagues that have an improvement of working during many years. We have worked locally, not that regionally, but it's important that ERCAL would switch to the institution in the region to be the reference for all of the governments, that we can be together in those meetings as health authorities. And I would like that representatives from ERCAL that we have in meetings with the National Assembly, to find out that we are leveraged with an institution that is supporting us, and we not only as federations, but behind us there is a strong institutions, and we have 12 federations in the region. So I think it would come from over there. Then ERCA would be that institution, reference institution, like with starting education programs to doctors, to patients, to those that are related to the health ecosystem. That is the best thing that we can achieve as a region, and as Ecuador, we would request that. Thank you very much. So I'll give the floor to the president of ERCAL answering this question. I think that regarding that request, I am the leader of a federation and I have a lot of expectations regarding this topic, and I think that this is a path in which we have a lot of things to do, many things to do, and during many years. So I think that the response to these expectations from the different countries as collaboration, learning, and in here we have to learn the conditions and also the how do we ease the access based on equality. So we have really nice elements in the region, and I'm glad to say that there are a lot of things in the countries, and according to what Marilena said, not only in big countries have a lot of expectations, but there are also small countries that have been working, for example, Costa Rica, Uruguay, and we can learn a lot of things from them. So the challenge is in there. From ERCAL, we can open those spaces so we can find out about those great practices to include stakeholders from the same environment, legislation, stakeholders, talking about the academic point of view, and the scientific societies met for a long time, genetic societies that are started with management, and we have to connect them, and collaboration we should bring from ERCAL is these reference centers that because within the countries we have improved institutions that provide services and have achieved an expertise depending different situations and conditions, and we should connect those
crear esos
dots
hubs
in creating those hubs for investigation, innovation, and these centers that can help with that education and with that expertise, and taking advantage of that, creating that network nowadays like Europe has it. So we have to take advantage of that organization and that idea. So considering the task force and that group work, it's like a call to analyze and generate or to strengthen that diagnosis that we have had during these conversations, and also raise that voice mostly from the region on how can we translate that into concrete facts, because we realize that there is not enough with policies. Colombia is an example of that. We have a lot of we are good making plans, and also have to translate that into concrete facts, and the families will see that resolution from the WHO that is far away in Geneva. How can it be translated to as a patient or a family has lower or less access barriers, and avoid having these situations in this everyday challenge. So the challenge is in there to go further, go beyond the legislations, and create those situations transforming the realities of the families. So thank you, Diego, for closing, and I would like to thank the panelists. In this last panel, the conversation continues, and I would like to clarify that this is not only a starting conversation, but ERCAL is a young platform that took great leaps that from the moment of starting with the regional work with the group. With, it goes beyond working slowly and walking slower, but with a bigger idea and thank the audience for being here, and the panelists, Jacqueline, Marilena, Diego, Felix, and Alejandro, that are virtually. And we're going to close with the forum, inviting officially to the third Congress of Rare Diseases for the Caribbean in Latin America that's going to be held in Santiago next year in August. If you follow us in the networks at ERCAL and AHF, we're going to publish more information about that. And we invite all of the stakeholders to continue with the conversation, not only in relation to the declaration, but also in what we're doing in Latin America. So thank you very much, and we conclude this session now. Thank you. Thank you.
Bienvenidos al segundo Congreso de Enfermedades Raras de Latinoamérica.